People used to think snoring is a sign of good sleep, deep sleep, which was a misconception. In
Sound
fact,
sleep.
the person is not sleeping at all. So that's a misconception, and they need to be tested and taken care of.
You have a choice with reference to the choices, but you don't have a choice with reference to the consequence of your choices. So,
Sleep is important for physical health, mental health, and spiritual health. And it is a necessity, it's not a luxury.
unresolved emotions, unfulfilled desire, a restless mind will not allow the person to sleep. What's the point in having 100 acquaintances and major relationship are missing out?
Yes,
Are
absolutely.
messing up or are missing out?
I mentioned sleep apnea is an independent risk factor for a lot of major health issues like heart attacks, strokes, anxiety, depression, obesity, heart failures, kidney problems, a lot of other.
Friends, fall asleep in 10 seconds. A luxury which every individual, be it your poor or the most wealthiest person, the most beautiful or the powerful person, falling asleep in 10 seconds when you hit the pillow is a luxury we should not miss out on our life. Why I'm telling you is sleep is not an optional lifestyle luxury. Sleep is a non negotiable biological necessity. There's another beautiful statement made. Sleep is the greatest legal performance enhancing drug that most people are probably neglecting. They say the best bridge between despair and hope is a good night's sleep. To discuss this, we have Dr. Lavanya with us, a specialist in sleep medicine and sleep therapy.
Dr. Lavanya Gali, a board certified internal medicine physician and sleep medicine specialist with over 15 years of experience. As a former medical director of several sleep labs, I've helped patients with everything from sleep apnea and insomnia to complex circadian rhythm disorders. Sleep isn't just about rest, it's one of the most powerful tools we have for long term health and well being. My approach is holistic and evidence based, focused on helping people understand why sleep matters and how to take real practical steps toward better sleep. Because when you sleep better, you live better. And that's the kind of transformation I'm passionate about helping every patient achieve.
So, we are so happy to discuss on this topic, which most people consider it very casual. They don't even give it a serious thought. But now sleep has come to the mainstream. Everybody talks about sleep, and let me tell you how essential your mental health is and your physical health. Similarly, if there is something called sleep health, it has to be considered equally important to mental health. So, we are glad that we're taking up this topic, which concerns a youngster to an old age person. In fact, a person when they start aging in their life, the quality of sleep is also most important. So, thank you, Lavanya Garu, for joining us on this episode on falling asleep in 10 seconds.
Thank you, Sreedharan Garu. Thank you for having me here.
It is. So you are the person who can throw more light on it. We come from that standpoint of Vedanta and spirituality. Our approach to sleep is slightly different. But your approach is scientific, is on the medical aspects. So we thought we will have a amalgamation of both spirituality and medicine in this most important lifestyle luxury.
Absolutely. So, as you rightly said, sleep is important for physical health, mental health, and spiritual health. And it is a necessity, it's not a luxury. Uh, Everybody has their own sleep and wake up times. And the 8 hours of sleep that we get determines the other 16 hours of the time we spend during the day. So it's that important. And I'd like to ask you this: what do you think? What prevents us from falling asleep?
Right. Good question. Most people seem to have it. What prevents us from falling asleep? What prevents an individual from falling asleep from the spiritual point of view? Vedantic perspective is, they say, these masters say they are a person whose mind is restless, whose mind is disturbed because something happened during the day or during the week, or something which might happen in the next week. A disturbed mind, an agitated, restless mind finds it difficult to sleep. You may have the best of comforts. You may have a zen setting in their bedroom, an expensive mattress, but unresolved emotions, unfulfilled desire, a restless mind will not allow the person to sleep. So we keep highlighting the subtle controls the gross. Even while driving up to the studio, we were discussing the gross has an influence over the when I say gross, nice mattress, lighting, dim lights, less noise externally, all that is conducive for a good sleep. But internal noise, the noise of the mind space which is clouded with negativity, with anger, jealousy, these are the factors which, in the spiritual point of view, predominantly prevents a person from sleep. In fact, I keep highlighting, if you want to sleep, if a person wants to sleep well, their waking time must be utilized properly. The waking time. If they're wake, if when they're awake, how they deal with their different roles in life, all these things has an impact on how the sleep happens in their life. So that's why sleep is a state of rest, essential for physical and mental well-being. In fact, if I may even stress that sleep is important for material well-being also. A person wants to make clear choices in their work, in their business.
Exactly.
If they have not slept properly, their their energy levels are less, their cognitive skills are poor. So sleep is a must. It is a person could be a driver. I mean, I remember we were taking a drive in the we are driving in Leh Ladakh. The driver did not sleep properly. We ended up in an accident, but nothing happened. But it doesn't matter. It's as from a standpoint of a driver to a person who's driving a country. All of them need to have proper sleep. In fact, the other day I was watching an interview of Prime Minister Modi. He was also mentioning the essentials to proper sleep, and so which is very very essential. So that's what I'm saying. And sleep, in our understanding, ex- uh, improves your concentration, improves your productivity. So again, as we started with, sleep is the greatest legally available performance enhancing drug that not many are using it properly. And that's why you should sleep like a child. You should
Absolutely.
sleep like a child. When you hit the pillow, in 10 seconds, you should fall off to sleep. That's what my guru used to say. Swami Parthasarthi Garuda, he's close to 99 years now. And he made this famous. You should sleep in 10 seconds like a baby. I mean, the science may say it may take 10 minutes, but still, 10 minutes itself is good. But sleeping in 10 seconds, it's an attitude. When you hit the pillow, you're off to sleep, which means the mind is clear, mind is calm. There could be many difficult, tough situations a person faces, but at the mind level, they are dealing with it gracefully. That's why the unresolved emotions, unfulfilled desires, a stressful mind, incomplete thought cycles, in more importantly, experiences where you have not given a closure. Many a times we have not given a mental closure. And according to Vedanta, they say that comes up in sleep. It is if you have not give I have not given a mental closure to certain situation. Somebody insulted me. I have not processed it properly. I have not given it a closure. Or it is then if I have not given a closure, that thought comes back while I am trying to sleep. So this is what I can understand from your question. I mean, the question of why most people are finding it difficult to sleep.
Absolutely. I
They-
agree with you.
I'm glad
Also,
I mean, a medical practitioner agreeing with a spiritual practitioner is a nice, is a nice combination.
So, all you said is something we believe and we do tell our patients and practice in our medical practice. Scientifically, if you ask me, what are the reasons why we think
Right.
people don't fall asleep? There are multiple types of sleep disorders. And even insomnia, which is sleeplessness or difficulty falling asleep or difficulty maintaining a sleep, there is a wide variety of insomnia
Exactly.
cases itself. So, the reasons why a person could not or might not be able to fall asleep scientifically could be a small thing like changing in the environment, change of bed, change of pillow, to a bigger issue like a loss in the family, financial loss, and anything in between can affect, especially when they're genetically prone to insomnia. It affects them even worse and even quicker. So these are all the reasons. And we try to find those reasons and fix them. But what you said, restless mind, agitated mind. So, how we deal with this in practice is we tell our patients to write down 1 hour before bedtime. That comes in under good sleep hygiene rules. 1 hour before bedtime, they're not supposed to watch a screen, any screen for that matter. So, we'll explain why a bit later. But that time can be utilized to calm the mind, relax the mind. And if anxiousness or agitation is what is preventing you from falling asleep, so we tell them to write down what is bothering them. So it is off their mind. They don't have to think about it. Or if they have to accomplish something the next day, write it down so that it's not on your mind. Morning you wake up and you read it, it's all there. Nothing is lost. So you can sleep peacefully. At least it gives them some calmness, some rest to the mind, and they're able to fall asleep. That's one of the tips that we tell our patients to do. So,
I'm glad. See, it is, there are quite a few people to fall asleep, they take pills. I mean, I don't prefer anyone taking it, but extreme cases is fine. But people do take pills for sleeping.
absolutely. Yes. So it depends. There, as I mentioned in the book, there are more than 83 sleep disorders listed.
83.
And not all of them need pills. Some of them could be just better lifestyle practices, better sleep hygiene practices, and finding the underlying disorder. It could be just a simple neck pain that is preventing them from falling asleep. This is all from the medical aspect. Spiritual aspect, you are a better person to talk about the spiritual aspect of it. But restless mind does come up a lot of times, and we do suggest people, our patients, do yoga, meditation, because that helps them with spiritual growth, calming their mind. So it is definitely widely, and patients do come and tell us, I've tried yoga before and it did help me fall asleep quicker, and I was able to get over that phase. uh, every There's a lot of surveys done. I don't want to name the surveys, but 1 in 2 people suffer from some kind of sleeplessness at some point of their life, if not all the time, at some phase when they had a stressful period or when they're doing something that they need to finish, some point of their phase. So that's like
It's
almost
correct,
everybody.
correct, almost. And this was not considered mainstream when we started off. Sleep, a person who is stressful, they say that's how life is. Or a person who is a little older, they say that's a natural thing. But now people have started talking about it, started understanding the importance of sleep. And it is, in my observation or an opinion, it is a form of wealth. You have material wealth. This also, I mean, a person who has material wealth can't sleep, will despise at a person who may have less, but he sleeps very well. It is,
Absolutely.
in a way, the person who goes through the lack of sleep alone understands the value of sleep.
Yes.
It is, yeah, even at times, for no reason you're not able to sleep. I mean, I'm not stressed. I don't have any issue, but I want to sleep. It's sometimes just you're awake, and so that's why I'm saying I'm glad that it has come to mainstream, and it is the earlier we set right this malady, we are better off, and that's why it is essential. We can't do away with it. And if the intervention of medicine is less, then it is better. Otherwise, people may get used to that, and without that, they may find going to
Yes.
sleep not that easy.
So medication, I say it is the last option. So first is lifestyle changes. Second is relaxation techniques. There are multiple relaxation techniques available, including yoga, meditation, breathing exercises, progressive muscle relaxation. All these. There music therapy, sound therapy. There are lots of relaxation techniques available. After going through all these and trying to see what is the underlying disorder or what is the underlying reason that the person is not being able to fall asleep and manage that in a better way, the last option is when we use medication, because they are addictive. And once we start them on a medication, it's our responsibility to take them off the medication. So I prefer not to use the medication
Excellent.
right away.
Correct. Excellent. It's like a painkiller, I guess. It's
It's like a painkiller, exactly. So it's only symptomatic. As long as you take it, sometimes after a while you get resistant and you develop tolerance to the medication and it doesn't work anymore.
correct.
So that's the reason why I don't want to, or even if I start, it's a very low dose that I start.
And you start only to end it as soon as possible. Once it's
Exactly.
not like a
and and lifestyle modifications are the key. Even if I put them on a medication, those are the things that they need to follow irrespective of medication or not. They are we'll go over the lifestyle changes and sleep hygiene rules.
fantastic. I'm glad you mentioned this. In fact, I think this sleep disorder is a global phenomenon. It's not that it is affecting the poor countries or developing countries or developed nations. I think across the table, everyone, everywhere, this issue is there.
Yes.
And we will discuss on it. And there are a few things I want to take up now with you. We want to debunk the misconceptions regarding sleep. At times I meet young entrepreneurs and all who say, throughout the week we are very busy. I try to catch up on sleep on the weekend.
Yes.
They are they are horizontal on the weekend. It is bed breakfast, bed lunch, everything. They say what I lost in sleep during the week, I try to make up either during the weekend. Or I've known some people who say, for me, 4 hours is enough. It is for me, it's not enough. You need
Yeah.
7, 6, 7 minimum
Yes.
7 hours. And there are see and there are people who, if I missed out on sleep, I'll take another 20 minutes power nap. It works. So you are the authority on sleep medicine. Can we debunk the misconceptions regarding sleep?
Sure. So I already found three misconceptions in what you just spoke about. I will work through the weekdays and I will get catch up on my sleep during the weekends. That is not happening. You might feel better after an extra hour or 2 hours of sleep over the weekend, but the sleep debt that you have been accumulating over the past week or on a long term basis, you will never be able to clear it. It stays and it has long term consequences on your mental and physical well being. So, sleep enough every day. It's like you eating food enough for the day. You have to sleep enough for the day. 1 hour here, there is fine, but you can't cut down on sleep and think that you'll be able to catch up over the weekend. Second thing, you mentioned I will eat my breakfast in bed, lunch in bed. That is a big no. Beds are supposed to be associated with sleep. The brain has to know that a bed is meant to be slept. So when you go to bed, you fall asleep right away because that association, the brain had made the connections. So if you're eating in bed, if you're reading in bed, if you're doing anything else in bed, that association is lost. So even when you look at the bed, it's not connecting with sleep. So nothing in bed except for sleeping. The third thing, 4 hours of sleep. 8 hours is what you normally hear, but that's not a magic number. Anywhere between 6 to 10 hours could be a normal person's requirement. I probably need 10 hours of sleep. I might be cranky if you wake me up after 8 hours of sleep. But for somebody who needs 6 hours of sleep, if you ask him or her, to stay in bed for 8 hours, they will be cranky. So know how much sleep you need. 6 to 10 hours is the range. If you're sleeping less than that or more than that, a person needs to be evaluated. There could be a reason why they are sleeping lesser than that or more than that. Those are the three from what we just said, but there are a lot more misconceptions that we come across. Alcohol is good for sleep. It is not. Scientifically, there are two ways it affects sleep. One, people think it puts you to sleep right away. Could be because of the sedative effects of alcohol. You might be falling asleep right away. But when alcohol has a very short half life, 2.5, 3 hours, that's it. So when it is getting metabolized in the liver, the byproducts are stimulating. So you wake up after those 2 hours, your sleep is very disturbed. You wake up frequently and you don't feel like you've slept enough. That's one thing. The second way it affects is because of the sedative property, there's a disorder called sleep apnea. So that affects the breathing while you're sleeping. Snoring is a symptom of sleep apnea. So the sedative effect of alcohol makes sleep apnea even worse. So that's another way. With sleep apnea, whatever sleep you get, even though when people look at you, you look at the person with sleep apnea, they look like they're sleeping very well, they're sleeping deeply. Their brain is constantly waking up without even them noticing it. So that's a very disturbed sleep. The other misconceptions are older people need lesser sleep. They don't. They need as much sleep as they needed when they were in their 30s. The only thing with older people is after their retirement, after their responsibilities are done, their sleep cycle might be disturbed. They might be napping during the day, but in a 24-hour period, their requirement of sleep will still be 8 to 9 hours or whatever it was before. It's just that it is distributed during the day. It doesn't mean they need lesser sleep. Watching TV or scrolling through apps helps you relax. No, it does not. Two ways. One is the content that you're watching. It could be stimulating. I am probably watching an investigative series. Right. It keeps me up all night. Even after I stop watching thinking about it, or even if I'm not thinking about it, the chemicals have already been released in my brain while I was watching it, which won't let me fall asleep. Second thing is that the blue light that is emitted from the devices, that is not conducive to sleep. So our brains they secrete a substance called melatonin when it is time for us to fall asleep. So this tells the brain, it doesn't put us to sleep, but it tells the brain that it is time to sleep. It is preparation to sleep. So this light, what it does is it negates the effects of melatonin. So the brain doesn't know it needs to sleep now. So it stays up as long as it's being exposed to that light, and even after a little bit after the exposure to light. So the two ways that it affects scrolling and yeah. Another misconception is waking up every 4 to 6 hours in the middle of the night is not normal.
Not normal.
It is normal.
It is normal.
The misconception is it is not normal. Okay. So, what I mean when I say it is a misconception is people do wake up 4 to 6 hours, either to change their position or to use the washroom, whatever it is. The problem is, it is a problem when they're not able to fall back asleep after waking up. If they're taking more than half an hour or 1 hour to fall back asleep. If they wake up, they go back to sleep, that's normal. So it's nothing to worry
Nothing
about.
to worry. It's not a difficult situation. It's normal.
It's normal to wake up 4 to 6 hours. If you don't wake up, that's fine. Don't think you should be waking up.
Right.
So even if you wake up, it's fine. If you're going back to sleep right away, you do your thing, you changed your position, you used your washroom, then you go back to sleep, it's fine. You don't have to worry about it.
Interesting. Because there's a lot of misunderstanding about sleep. There are youngsters who say they say 4 hours is enough. I'm glad that you're debunking all these misconceptions, because sleep is essential, and I'm glad that you're mentioning these aspects, and I guess it should be a subject youngsters should study, should learn.
It's good that you say that. This reminds me of something that I thought of when I was studying sleep. So I did my medicine here in Hyderabad, and I went to the US after getting married, and I was doing my observership, and I was working as a volunteer in a hospital where sleep medicine was a department. Until I went there, I did not know. And the knowledge I had about sleep when I was studying medicine here in those days when I was younger, this is like 20 years ago, 25 years ago, or even more. I don't want to say that, but yeah, 25 years ago. It was only a paragraph about sleep. That's all I knew about sleep. And I would have forgotten it if I had not gone there and seen what all was happening in sleep. I went to the sleep clinic, I shadowed sleep professor and all that. And that's when I am like, this is all I know from my medical knowledge. It's just 3, 4 lines paragraph about sleep. And there's so much that is happening in sleep. And that's what got me interested in sleep medicine. Then I went on to do my internal medicine residency and then went back to do my fellowship in sleep medicine.
Fantastic. You had the foresight that this is an essential aspect. It is like in some of our scriptures, there is no reference to depression.
Yes.
Talk about the Bhagavad Gita or Upanishads. Where is Arjuna was emotionally distraught, but it was not that he was depression. Because maybe that was not the normal scenario. Now that it is not just mainstream, it is right on our face. I guess
Sleep
right on
is
our face. This disorder.
Sleep and certain sleep disorders have been identified as risk factors, like diabetes is a risk factor for heart attack or stroke. Some of the sleep disorders like sleep apnea, they've been identified as independent risk factors for heart attacks, for strokes, for heart failure, for obesity, lot of other physical ailments.
Wow. I'm glad that the whole the idea of this podcast is to communicate the importance of this lifestyle change. We need to have the proper. One is the quantity and the quality. Both of it we are trying to emphasize, and the earlier they bring about this change, the better it is. The improvement in this lifestyle, then better it is. So I'm glad.
Absolutely. So when they are kids, babies itself, we have to train them the right way. So when it is a baby, they have their own routine. But when they can understand and see pictures, you read books to them or you have them listen to music instead of watching an iPad or a YouTube channel. You sit with them or lie down in bed with them and read with them 10 minutes, 15 minutes. That's all they need.
Correct.
But that puts them in a habit of doing that instead of sitting in front of a screen.
Correct.
So that 1 hour before bedtime. So let me maybe elaborate sleep hygiene rules while we are here. So there are a set of rules that scientifically have proven, and there are scientific reasons behind every rule that I'm going to mention now. Sleep time and wake up time have to be consistent. That is because the biological clock learns and it tells us everybody has its own biological clock. I might feel sleepy when it's 10 in the night. You might feel sleepy at 12 in the night. But your biological clock is set that way. But listen to your biological clock. Have a consistent sleep time and wake up time. 1 hour variation. Nowadays, we all have things to do in the evenings, things to do in the mornings. So 1 hour variation is what I don't suggest anything beyond that.
The plus or minus is
Plus
fine.
or minus 1 hour. So wake time and sleep time and wake up time should be consistent. Second thing is the temperature of the room. If it's too hot, too cold, whatever is comfortable for you. Some people might feel cold in certain temperatures, some people might feel warm in certain temperatures, whatever is comfortable for you. Caffeine, coffee, tea, that also,
When you mentioned the temperature, just going back
yes,
toward that, I was told that if the room temperature in a where you're sleeping, if it is 2 degrees lesser than your body temperature, that
is
supplements
conducive.
sleep. Is that right?
Yes. Even the body temperature, the within our body temperature also falls slightly before
Oh,
we fall
sleep.
asleep.
Okay, okay.
So if you think about it, olden days we grew up saying take a warm shower. If you're not able to fall asleep, take a warm bath. So that warm bath raises the body temperature and then quickly brings it down when you're out of the shower. So that's how you're preparing your body to fall
Right,
asleep.
right.
So even our olden days, the little tips that we grew up with, those also have some science
Correct,
behind it.
correct.
But coming back to the list,
Caffeine.
caffeine, however you're sensitive, some people can have a cup of tea in the evening and be fine in the night. Some people are really sensitive, so nothing after noon. So they need to figure out how sensitive they are to caffeine. Alcohol, we just spoke about it. No alcohol, at least 3 hours before bedtime. This is not a permission to drink alcohol, but at least 3 hours before bedtime.
See, what you're saying is don't have it in the evening. Have it other parts of the. I mean, I was joking.
Yeah, no, that is not what I meant, but no
I
alcohol is
agree.
best.
I
But
agree.
yeah, no screens 1 hour before bedtime. What you can do during that time is listen to music, talk to your family, spend some time with your family, prepare for your next day.
Correct.
Uh, Write down, like we just mentioned, write down the things so that they're off your mind. So, all these things, if you follow, these are the lifestyle changes that will stay with you forever.
In a way, you are saying you have to prepare yourself to sleep.
Yes.
No, it's not. It is not like going and sitting in a sofa or
Yes.
putting switching on a TV and then it's like there's a mental and a physical preparation towards sleep.
And that has to become automatic. It shouldn't be an effort
Right.
to all these things.
Right.
So, if your bedtime is approaching, you should automatically shut off your screens, which unfortunately, with the globalization and working at different times,
Correct.
people find it hard. But prioritize things. Sleep is important for now and for tomorrow also.
Correct.
So, prioritize things, and this has to become automatic.
Correct. I mean, it's essential. And, it is what do you call not using the gadget or 1 hour before sleep is
Yes.
a tough ask for many people.
And lot of people, when they wake up in the middle of the night and when they're not able to fall asleep, the first thing that
Correct.
comes is the phone or the
Yes.
iPad in the bed
Correct.
itself.
Correct. Correct.
So that shouldn't be the case. You can
Yes.
get out of bed if usually we say 20 minutes is the time we give for a person to fall asleep
Okay.
scientifically.
20 minutes.
20 minutes. So, and we tell them not to look at their clocks. It should be mental minutes. If you think it's been 20 minutes in bed and you have not fallen asleep, we tell them to get out of bed
Ah.
and try to do something which is relaxing. Don't watch TV, don't read the newspaper, something relaxing. You can read your spiritual books, you can listen to music, and then go back to sleep when you are feeling sleepy. There is something called sleep restrictive therapy.
Sleep restrictive therapy.
Yeah. So we tell them so that we are training the brain to associate bed with sleep. That association, when it forms,
Correct.
when you go to bed, you automatically fall asleep. It
I'm
has to be
glad.
an automatic
Correct.
process.
It is meant for sleep.
It is
And
meant for
it is
sleep.
meant. It is. We keep highlighting the thought association.
Yes.
It is the moment you associate a bed with sleep. When you're lying down, it knows it is for
It
sleep.
knows there is no effort. It knows and brain shuts off automatically.
Excellent. I mean, these are I think a lot of people have taken it for granted.
Absolutely.
There's so much ignorance. I mean, even if people are aware, but still they are not willing to pursue certain things.
Yes.
There's ignorance, there is too much of influence, and as we started off, it's an uncontrolled mind, an indisciplined mind,
Yes.
which goes through it and eventually suffers.
The amount of data and knowledge available today and accessible, it keeps our brain active
Correct.
how much ever you want it to be.
Correct.
Shutting off is the issue.
Correct. In fact, it's almost impossible to shut off. But most people whom I interact with, they shut off out of exhaustion.
Exactly.
It is, I can't be awake anymore. Therefore, they get to sleep.
Yes.
It is not out of. It is. They don't. It's not that it's time. I think if they understand the importance of it, what it does to an individual, it regenerates energy. That's where you repair your body. That's when the quietness gives you more clarity. There's a statement, right? Let me sleep over it, and then I'll come
Yes.
back to you. Let me sleep
So the
over it.
brain processes everything while we are sleeping and
Correct.
everything becomes clearer.
Correct.
So that's probably why we say let me sleep over it
And
and then tomorrow morning I'll decide, I'll think
decide on it.
about it.
There's a little extra clarity which
Yes.
makes all the difference.
Yes.
That I'm glad.
So Sreedharan Garu, I would like to understand a few things. Why do dreams happen?
I'm glad you're asking. And dreams, the each one helplessly experiences dream, and what Vedanta, what the spiritual side of it suggests is the incomplete thought cycles you entertain during the day eventually manifests as a dream in the night when you are asleep. There is no correlation that today there was you wanted to meet a friend, you fixed a time and a location, but some other guest came in, you couldn't meet up with the friend. That's an incomplete thought cycle, and suddenly in the dream, you looks like you met your friend, had a nice conversation. I'm just saying, in very minuscule ways, you'll observe many of the dreams from an incomplete thought cycle to a very strong desire which has not been fulfilled for a long period of time. See, these are the see, if I may not get a dream of going to Mars, and then because that's not a desire I've entertained. That is not even a thought cycle I've processed. So I'm not going to get a dream of going to Mars. Maybe Jeff Bezos, a few others can have it because that's the thought they entertain. And if it doesn't happen, one of the satellite is not going up properly, that affects them. For us, there's no such. So in simple terms, a very strong desire not being fulfilled, not being resolved for a considerable period of time, or a thought cycle you entertained in a day, it will manifest as a dream. And it is that's what they say, it's nature's support system in us. The nature has given you that support system to fulfill something which appears to be difficult. So it is this is one of the this is why a dream, nature's gift to us. And it is if you can work on it, all that we're saying is it is watch out on the incomplete thought cycles. Any thought cycle you have entertained, not given a closure, it will linger in the mind. Any desire which you have entertained, not fulfilled for a considerable period of time, will linger in the mind. And so all these unresolved goal, all these things play in your mind in a certain time, and nature helps you to fulfill it. That's the reason many a time I've known one, I would say, sales manager. He had a big difference of opinion with his boss. In his dream, he said he had a dream where he slapped his boss. Not a right one, but in the waking state, if he does it, that's the last day he's working there. Or he may not get a job anywhere else after that. Who's gonna? He says in dream it came up that as if he has given a piece of his mind to his boss. So nature's support system. It is so that's how dreams happen. The ideal thing is not to have a dream, if you ask me. Why to entertain a thought and not allow it to fulfill? Why to not give it a closure? Or why to entertain a desire and allow it to be unfulfilled for a long period of time? So it is, if you are, that's why I say, how well you deal with the waking state of consciousness, accordingly the dream happens. See, according to Vedanta, according to all the scriptures, then you take all the Upanishads or the Vedas, they say that each individual goes through three states of consciousness. Waking state of consciousness, where I am, we are fully available. Our body, mind, and intellect, manas, sharira, manas, and buddhi, fully available for our use. That is the waking state of consciousness. When after that we may slip into a dream state of consciousness, where you go through a dream. That's where I said an incomplete thought cycle, an unresolved desire, nature's support system to help us fulfill during the dream. That is a dream state of consciousness, where you don't have a control. It's just happening. It's like a movie playing around, and you don't. Some many dreams we are not even aware of. Many other dreams we are not even conscious of. The third state of consciousness is called the deep sleep state of consciousness, which is dreamless sleep. That is where the real rest or rejuvenation, everything happens. Dreamless sleep. So these are the three states of consciousness. Waking state, you have a control. Dream state, you don't have a control. Deep sleep state, there is no possibility of control. It's sleepless, dreamless sleep. You're just you're unconscious of it. You would know that I had a fantastic sleep when after you woke up. So it was a restful sleep, deep sleep. A person who experiences even 2 hours, 3 hours of deep sleep, they are fully energized. Or the other person says, I had a terrible nightmare. When they wake up, so these are the three states of consciousness. Dream is predominantly unfulfilled desire. When I say what you call unresolved desires, and predominantly the incomplete thought cycles. In a day where most of the thoughts you entertained, you completed it. You wanted to do a particular task, you completed. You wanted to take your children for a music class, you completed. There was a dinner in the evening for 20 guests, and you had 5 items to prepare. You made one extra also, you completed it. In days where there is very less or no incomplete thought cycles, dreams are less. Which means what? The proportion of deep sleep is more. So, that's the that is a major reason. But I'm sure
So
science has its
this,
own reasons.
yeah, what you said is in line with something called Freudian theory.
Okay.
Sigmund Freud, who is a groundbreaking scientist in the field of psychology and sleep, his theory states exactly what you just mentioned. Dreams are an expression of unresolved desires and repressed thoughts, which is exactly what you
Okay.
just said.
Okay.
And we think that the brain is trying to make sense of the electrical and chemical activity that is going on in the brain while sleeping. You also mentioned about stages of consciousness or sleep. So we also have stages of sleep scientifically. Stage 1 is when you're trying to fall asleep. Your brain waves slow down. They're still fast, but they're not as fast as when you're in waking stage. Stage 2, light sleep. Stage 3, there's no stage 4 anymore. It's stage 3. This is the deep sleep. Delta wave sleep is what we call. And then there's REM sleep. Stage 1, stage 2, stage 3, they come under non-REM sleep.
Non-REM sleep.
REM sleep, it's rapid eye movement sleep. REM sleep is where people dream, lots of dreams. And delta wave sleep is the deeper stage of sleep that you mentioned. So these stages have their own significance. As a baby, as an infant, REM stage of sleep compiles the longer duration of their sleep
For a baby.
for a baby. That's because REM sleep, memory consolidation, learning, all these processes are happening. And a baby is learning faster than what we are learning at our age, the initial stages of life. That is the reason why their sleep is mostly REM sleep. And as you age, as the kids grow into adolescents and adults, REM sleep becomes lesser and lesser. Deep sleep becomes more and more. Stage 2 and deep sleep. That's because we are repairing, restoring deeper
Interesting.
sleep.
See, this question looks, I don't know whether it's absurd. The rapid eye movement.
Yes.
Is it actually a person is closing when the dream is actually rapid eye movement?
It is actually rapid eye movement. So we do something called polysomnography. In general terms, it's called a sleep study. It's an overnight study where we monitor the eye movements also.
Okay.
And the eyes actually go all over.
It's like you're
When you look at a baby, you see the eyeballs going all over. That's exactly what we see on the
which
sleep
means
study.
they are. It is actually like a a movie playing around for them.
Exactly. It's the whatever the reason is, the eyes are rapidly moving,
Rapidly moving.
and which is not seen in other phases of sleep, other stages of sleep. Only in wakefulness, and they also go in opposite direction also.
I think in the waking state of consciousness, it's conscious
Yes.
rapid eye movement.
Yes. This
In a
is
dream is
yes.
unconscious. It's like it just goes through. It's like a
Yes.
flow.
Yes. And that
And deep sleep, there's no rapid eye movement.
there is
There's
no
no movement at all.
rapid eye movement. And the brain waves are slow. They're called delta waves, big and slow waves. So calm and peace. When you look
Fantastic,
at the EEG, that's what it looks like.
Is it? Is it?
And REM sleep, the brain is super active. Yeah, there are neuroimaging studies and images available online when you type in sleep versus wakefulness, or lighter sleep versus REM stage of sleep neuroimages. When you're in your lighter sleep, or when you're not wakefulness that much, but when you're in your lighter sleep versus REM sleep, the brain is very active in REM sleep.
Is it? Wow.
So it's close to wakefulness, or even more than wakefulness. The amount of activity that is going on in the neuroimages, it's close to wakefulness or even more.
Wow.
And the best part is when you're sleeping, especially when we are in REM sleep and we are dreaming, our body is in complete paralysis mode.
Uh-huh.
And that is a protective mechanism.
Can you explain that further?
So in
Paralysis mode.
it's completely paralytic, the body. And there is a reason why it has to be that way. So REM sleep is when most of the dreams happen. And if you're dreaming that you're boxing somebody in a boxing ring, or cycling somewhere, you don't want to be acting it out while you're sleeping and boxing the person sleeping next to you, right?
Right.
So this paralytic mode does not allow you to act out whatever you're dreaming.
I mean,
So,
go ahead. No, it sounds very interesting for me.
So this is, and there are disorders where this mechanism is disrupted,
They
and
actually hit.
you actually hit, or you actually act out your dreams.
Right.
Forget about hitting.
Right.
You
Correct.
actually act out your dreams, whatever you're dreaming. The people trying to cycle in the bed.
Right.
So it's a protective mechanism given to us, so that we don't hurt ourselves or the person sleeping next
And at
to
the
us.
same time, it's dissolved.
At the same time, it's dissolved.
What a nature's blessing. Huh?
Yes.
I mean, I used to think of various nature's blessing. Now that one more, item is added to it.
Exactly.
It is,
If you're dreaming of that you're jumping jumping off a cliff, you don't want to be jumping out through the.
correct in the real terms.
So you're
And
paralyzed. Even if you want to, you won't be able to.
the only paralysis a person can afford to have is this
REM
dream,
in REM
paralysis.
stage.
No, any other paralysis is not an option at all.
Yes, yes.
So I'm glad that you mentioned, because for me it's a nature's blessing. Can
It
you
is.
imagine nature's blessing? It's a protective mechanism ingrained in an individual.
Yes.
It's fantastic.
There are lots of things that we don't
Yeah.
know why they happen and how they happen, but they do, and most of them are for protecting us. That's how the body is.
My guru used to say, there are things you know, there are things you don't know, there are things you will never know.
Yes.
These are the things we'll never know. How is that? I mean, whatever is that energy or the source or whatever you call, is helping the most ridiculous to the most benevolent
Yes.
person. It is what do you call paralytic and paralysis in REM,
In REM
in
sleep.
REM sleep. Fantastic. I'm glad that today is another eye-opening aspect in this, because it opens up a lot.
Yeah. So REM sleep behavior disorder is where this connection is lost and they tend to act out their dreams. So
Correct.
that's one of the 83 or even more disorders that I had mentioned.
I think with time coming up, it will be 183 disorders. It is
Yeah, I
not
don't
gonna.
want it to get there, but yeah.
I find a 9-year-old kid saying, "I'm too stressed out." I said, "What? You're stressed?"
Exactly. Do they even know the meaning
Oh,
of the word
stress.
stressed? That's a
Correct.
sad state. But it's not too late. They can still be trained to manage their stress better. Maybe the stress
Right.
levels have increased from when we were growing up
Yeah,
to
yeah.
now. But managing the stress
Correct.
is is what we need to learn.
We have to. I mean, everyone has to learn,
Yeah.
especially in the present day scenario, from a 6-year-old to the 96-year-old. They have to.
Yes, because
Managing stress is a necessary skill.
yes, because medication cannot be the answer every time.
Correct.
There are a
Correct.
lot of other things that we can resort to:
Correct.
yoga, meditation, the discourses.
Correct.
And the first time I've heard a Vedanta discourse was in 2011.
Wow.
And it was so simple to understand what we put our minds through and what we
Right.
do to ourselves. If
Right.
we understand that and if we prioritize what is important to us and
Correct.
what is not, it half of the stress is
Correct. It is mind management eventually. The great Swami Vivekananda made a beautiful statement. He said, "Conquer your mind, will conquer the world. Fall a prey to your mind, you become a victim of the world."
yes,
And John Milton, in his epic Paradise Lost, makes a beautiful statement. He said, "Your mind in its own place can make a hell out of a heaven or a heaven out of a hell."
yes,
Why I keep highlighting is, most people, they think heaven or hell are geographical locations. If it was a geographical location, the number of billionaires would have bought real estate there.
exactly,
It is a state of mind. It is
yes,
a state of mind. And whoever has this heaven as a state of mind, I think falling asleep is just like that.
absolutely,
Just like that.
absolutely,
That's why, that's the reason this podcast. We want everyone to experience this luxury. It's not
yes.
a, don't take it as an optional aspect.
Yes, it is a necessity for
Correct.
physical, mental, spiritual well being. So, I wanted to ask you another
Yes.
question. How does intellect play a role in mental wellness?
Yes. Gee, I'm going to answer that. Before that, Lavanya, I thought both of us can think of another question. What can we learn from our dream?
Hmm.
We mean, is there, from the medical standpoint, does it give anything, in the medical standpoint? From the spiritual standpoint, I can highlight certain things. From the medical standpoint, do you say, does it add value to it?
So, what we look at when we are looking at it from a medical standpoint is there are some conditions where people dream a lot and they feel like they have not slept at all. It's a constant reel going on in the back of their mind, a constant state of dreaming. But when somebody else is looking at that person, watching that person sleep, they think that person is sleeping fine.
Mm.
So, but the person is going through a kind of sleep disorder. A few, to name a few, sleep apnea is one, nightmares is one. So, trying to find what is the underlying disorder, medications could be one. So, trying to find what is the reason that they're going through so many dreams and treating it is our job. Trying to find a meaning to the dream, we don't tend to do that. We
Right.
we we usually stop at
Okay.
if are the dreams bothering you, are the dreams waking you up from sleep,
Right.
And is there a reason for you dreaming so
Right.
much? And we try to take care of those things depending on the clinical presentation and the medical conditions and the medications the patient is taking. Other than that, we don't go deeper
Deeper into
into
them.
trying to find a meaning
In
for
fact,
the.
from the spiritual standpoint, it had a great meaning. There was there's in the you've heard of King Janaka. He was one of those great Raja rishis. He had a dream that he was suffering out of starvation and poverty. Had a terrible dream. He had that he was, in fact, in the scriptures, King Janaka's dream. That episode is very is proverbial and sought after. So he was a king, and he was a king with all opulence and power. And he went through a dream. He went through a dream that he was like a beggar and suffering of starvation and poverty. And he woke up from that startling dream. And then he called his council of ministers. He said, am I the king who dreamt that he was a beggar last night going through penury and starvation? Or am I the beggar now dreaming that he is the king and going through this opulence? Who am I? That was his question. He said, am I the king who went through the dream that he was a beggar going through suffering? Or am I that beggar now imagining himself to be the king and going through this opulence? Who am I? And his Guru sage Ashtavakra says, you are neither the king nor the beggar. You are the supreme self. He says, Aham Brahmasmi. That is a aphorism. So, all that I'm saying is, these masters used waking, dream, and deep sleep to such a great extent. It is that's the reason King Janaka's question was a famous question. We also go through the dream, we don't even question anything.
Yeah.
It is sometimes when you, I'm, I guess, or I mean, when by through reading and through scientific inquiry, they say 90% of the dreams you may not know, or
Yes.
maybe 95, 99% of the
Yes.
dreams we may not know. That 1%, if you are aware, either what Vedanta says is observe. It must be some strong desire. It is like you want to go to the person wants to go to Tuscany and have a glass of wine. I don't know. It is a person keeps, or they want to go to Switzerland and have some chocolates, or the cruise.
Yes.
When you observe a certain desire, it might a certain dream. If you observe, it could highlight a very strong desire in you,
Which you're not even aware of.
not even aware of. So, either or it could be it could you are, could be jealous of something or very angry about something. It just brings to our awareness. Hey, you have to look into this. Be cautious. This is one of it, which is either this is not worth it. This jealousy is not worth it, or some kind of awareness should come into our play.
Yes.
So, I mean, that's what, from a Vedantic perspective, I find we can learn from the dream.
Absolutely.
It is. I wish there are many King Janakas. Where they go through it and it hits them. That's when.
As long as it's not a sleep disorder causing the dream.
So in our, for me, it inspired me a lot. Am I the king going through the, that he dreamt as a beggar, or am I that beggar now imagining himself to be the king?
Yes.
So we are where we are because we don't question that much.
Absolutely.
But now I'll get into your question. You asked a question, pertinent question.
Yes. How does intellect?
Help in mental wellness. See, we keep highlighting the intellect is the potential for us to take control of our lives in the best possible way. I would suggest a morning routine and a evening or a night routine. Morning routine, when you wake up, all my class members who are in the, we have this prayer. When we wake up, first thought is pranams to Mata, Pita, Guru, Deva. Pranams, Sashtanga Namaskar. My prostrations, my gratitude. My gratitude to my mother, father, my Guru, and the Almighty. You start the day with the most potent thought. One thought which drowns all other thoughts. Now, you thought you used, and they say, will it work? Try it out. It will do wonders. They say that's the reason they say gratitude is the mother of all virtues. You start with that's in Sanskrit even better. Pranams means namaskar to Mata, Pita, Guru, Devam. In English, the Westerners who attend, we suggest gratitude to my mother, father, the Guru, the Master, and the Almighty. So that is one. Then it is having started with that, the mind becomes a little calmer. We suggest at least 10 minutes of no roles. See, any thought is pertaining to a role. It could be you have a role of a medical practitioner, as a wife, as a mother, as a sister, as a daughter, as a friend. Any thought we entertain is pertaining to a role you have. And that will create a ripple of thoughts. Oh, I have to get this gift for the friend, and you make a note. I mean, it's a friend, or I got to go for there's evening dinner. It's the role of a spouse. So any thought is pertaining to a role. Having calmed the mind with gratitude, if 5 to 10 minutes, just quiet, no roles. A thought comes in, dismiss it. A thought comes in, dismiss it. The- then what happens that 10 minutes of quietness gives you a better clarity. Then we would suggest read something, whatever you're inspired by. In the morning, that's it is if you can read something which is inspirational, or the truth. You read something about the truth. Who am I? It could be a text, or my guru wrote a beautiful book called the Vedanta Treatise. It's a beautiful book, or whatever book you think is going to help you. Read 15 minutes, 15, 20 minutes, think about it. What do I understand? How can I implement? And then get into physical fitness, yoga, running, and all that. Then you're going to have a breakfast and go to work. And when you're at work, maybe you can concentrate 75 minutes at a stretch max. That itself is asking for a lot. Or 90 minutes, and after that 5-10 minutes of just relax.
Yes.
I'm not suggesting coffee here. I mean, just quietness. It's just it is relaxing your forehead, relaxing your eyes, and it could be just closing your eyes, and or shift. The whole thing is to shift the focus. You could read a quotation. I have a book of quotations. I read that. I remember there are many quotations, and one of the a quotation which I often refer at times is when will I be free? An American asked Swami Ramatirtha, when will I be free? To which Swami Ramatirtha said, when the I ceases to be. When will I be
Wonderful.
free? When the I, meaning the ego, when the I ceases to be. And there's another quotation, beautiful, which is the largest room in the world? And to which he said, a room for improvement. Which is the largest room in the world? A room for improvement. So just to shift our mind to something better,
Yeah.
progressive. And then if we are, so 75 to 90 minutes of focused work, 10-15 minutes of unwinding. Again, you keep doing it. This is the morning practice. You're coming back home, time with the family. It is, and then before the bedtime practice, we suggest is, first is a thank you gesture. Thank you for the day. You start with gratitude. You end with thank you for the
Gratitude.
day. And before that, we suggest a practice called introspection. Introspection is running through the activities of the day in a sequential manner without analyzing or criticizing. It's not that, oh, I should have told this to that person. No, you're not. It's like a program you're running through. And why we suggest introspection is each one is studying or learning about life. That is in one parallel going on, one vertical going on. Another is your life is going on in another vertical. The real transformation happens when this learning is amalgamated with your life. It has to be inculcated into your life. Then there is changes, there is growth. So one of the major aspect is, this transformation to happen, introspection, the process introspection helps us to become aware. Oh, here I did the right aspect. Or in I could have I could have responded in a better way. So whatever you're learning about life and life as such is happening, you are transferring that information into your life. As a result, it's no more an information, it's a part of your life. So for this transformation to happen, morning some study, and before you go to bed, 5 to 7 minutes of introspection. You run through the activities of the day. I woke up at 6:15, and then I checked the mobile, and I went down, made a coffee. I'm not talking about 100% accurate,
Yeah.
but I made a coffee, and then I did the yoga for half an hour. Then my daughter woke up, and she suddenly wanted a sandwich, and quickly prepared a sandwich, and then sent her to school. Then I had a guest for breakfast. You were running, you're not analyzing or criticizing, just running through it. You become aware, hey, I could have done this in a better way. After that, then what happens? Whatever you've learned, this individual study, right, where we improve our intellect, you are that which you're aware, you're bringing in to your daily life. So this is that's why, and once you have done that, the thank you practice. Thank you for the day. Whoever that entity is, somebody, this paralysis in dream. It is. Imagine if I do inflict pain on others, and what will happen to me?
Exactly.
Thank you for the day. And then if you're able to do that, what happens? You're improving your intellect. You're also making choices gracefully. Reason is, we keep highlighting, you have a choice with reference to the choices you can make, but you don't have a choice with reference to the consequence of your choices. It's like you have there's a bow and arrow. You can choose where to
Yes.
strike or where to hit. The moment you have released the arrow,
There's no control.
there's no control. You have a choice with reference to the choices, but you don't have a choice with reference to the consequence of your choices. So now you may face the consequence, and why is this happening? Why me?
Yes.
Many a times the consequence of your choices, or the regrets, the agitations, the sorrows will significantly reduce if if you go through the morning and the evening practice consistently, not once in a way.
Yes.
Let's say the morning, I am a big believer of the morning gratitude practice, pranams. Uh, Only two or three major relationship. At least that we should get it right.
Yes.
What's the point in having 100 acquaintances and major relationship I'm missing out,
Yes.
or
Absolutely.
messing up, or messing out? So get that right. I'm a big believer. A major relationship should be wonderful. It was so nice to see this morning. We had breakfast, but the Vamsi's parents and your mother, it's so nice. I keep telling, I don't have parents. What a blessing to have parents. Amma, to say somebody to respond.
Yeah.
What a monumental blessing.
Yes.
Only when you don't have it, you understand. It is gratitude. We start with gratitude. My mother is difficult to deal, but she's my mother.
Yes.
Forever grateful. Start with gratitude. It's at least 10 minutes of non-doing. Just if you can do that, just sit with yourself, eyes closed, or no movement, no roles. Don't bring in any roles, and then read something. See how many of us are inculcating fresh thoughts and ideas on a regular basis. All that we take in is news, and that also is opinionated.
Yes.
And they also, even each one has an agenda. We don't even know what is news these days, right?
Exactly.
How can there be breaking news 24/7?
Yes.
There can be only. I'm saying it is taken. I think it was Bernard Shaw. They asked him. A newspaper reporter asked, uh, what is your suggestion for the readers. He said, read not times, read eternities.
Hmm.
The
Yeah, yeah.
Times magazine only is asking, what is, read not times, read eternity, meaning truths of life.
Yeah.
Read about, do I know myself? And then your physical fitness. Then
Exactly.
get into work. Then have breaks in between.
Hmm.
Not coffee break. One and a half, I
Mental
had coffee.
breaks.
Mental breaks. Or it could be a laughter.
Hmm.
Some kind of a joke you read or something. It prepares you for the next task. And then towards the evening, means time with the family, little bit,
Yes.
and introspection, which is very important. You integrate. That's the integration process. Become awareness process. I've known a person who used to get annoyed, stressed out because of an elevator.
Hmm.
The, in the many countries, and even here,
Hmm.
you have elevators, 40 floors, 30 floors, and you are going at a time, you are pressing, it doesn't come,
Yeah.
and gets agitated,
Hmm.
and then goes down. Can you imagine? He starts with the agitation and in a traffic jam.
Hmm.
And he said, no, why am I doing this? If I'd go 10 minutes early, or, and then, if I do that, I am better off.
Hmm.
I mean, I'm so awareness, it looks common sense, but the introspection. Then, thank you, gratitude. Thank you. Genuinely, thank you. And then if you do that, slowly and slowly, your your intellect is becoming more aware, more stronger, and it is mind will be what it is.
Hmm.
Mind is a child, intellect is adult. Slowly, it will start supervising it in a good way. It will listen.
Yes.
It will listen. It is a, let's say, the mind
You
says,
can train your
it,
mind.
it is tough situations, but I will deal with it.
Hmm.
I'll deal with it. I'm still there. I'll deal with it. So that eventually will translate into a proper sleep. It is in the scriptures, Bhagavad Gita and all highlights that three states of mind: sattva, rajas, and tamas.
Hmm.
You know about it.
Yes.
Sattvic time is between 4 a.m. to 6 a.m.
Hmm.
Rajas is between 6 a.m. to 6 p.m.
Hmm.
Tamas is 6 p.m. to 4 a.m.
AM.
They say the sattva, a Sanskrit word which means purity,
Hmm.
serenity, wisdom. So we are most wise, or we are clear during the early part of the day. Even if a person likes the best of,
Yes.
single malt, you offer him at 5 o'clock in the morning. They're not now, after some
Yeah.
time. Little bit sattva is there.
Hmm.
Or sometimes, what that's when we said, we also discuss, let me sleep over it.
Hmm.
Next day morning, there's little more
Yes.
clarity.
Yes.
4 a.m. to 6 a.m. And then 6 a.m. to 6 p.m. Once the sun rises,
Hmm.
all activity starts.
Hmm.
Rajas,
Yeah.
full of activity, full of aggression, full of ambition, full of stress. 6 a.m. to 6 p.m. 6 p.m. Once the sun sets, 6 p.m. to 4 a.m. is tamas.
Hmm.
All the partying starts.
Hmm.
Till 3:30 they may party. After that, there's a little quietness
Hmm.
because their sattvic quality is less.
Hmm.
What the Gita, Bhagavad Gita and Upanishad says is each individual has sattva, rajas, and tamas. Each one of us are human beings, but each one of us have these three qualities, and we are all different because of the proportion of sattva, rajas, and tamas.
Absolutely. Yeah.
And sleep, if you are taking up to sleep properly, your sattvic quality enhances.
Yes.
That's what in our mind and intellect as an institution we say, promote sattva, control rajas, reduce tamas.
Hmm.
When we say promote sattva's morning time,
Hmm.
morning
Hmm.
practice, and control rajas doesn't mean you reduce your activity. When you promote sattva, there is clarity, there is calmness with which you will handle
Situation's better.
much more. Your productivity is better,
Hmm.
your concentration levels are better, your stress levels are less.
Hmm.
And then reduce tamas, meaning we're not suggesting don't party.
Hmm.
Because you go to bed early, your indulgences diminish
Hmm.
significantly. So this is how a person can develop their intellect, mental wellness, and as a result, as you mentioned, the sleep routine becomes better.
Yes.
You repair yourself, you heal yourself, you heal your body and the mind through sleep,
Yes.
and we are better individuals. Next day you are there, you're not drowsy, you're not stressed out, or you're not looking for the weekend and the
Mm.
holidays, what do you want to do? Nothing.
Mm.
Don't, in fact, it is like that. Weekend, I remember, even when you mentioned you can't keep up with the sleep on a weekend.
Mm.
It's almost like somebody telling 5 days I don't brush my teeth. Weekend 20 minutes each day I brush.
Exactly. So it doesn't
Does
work.
it work that way? Every day, 3 minutes or 4 minutes you have to do.
Yeah.
So that's my call. I have a similar question to you from your, you know, the sleep medicine standpoint. What is the role of sleep according in mental wellness, and how can you enhance the role of sleep in mental wellness with your medical background?
So sleep is very important for mental well-being
Right.
as well. And we say when you sleep lesser than what you need, you wake up with more irritability, more mood swings, and lesser concentration, lack of decision making skills. And it is said that most of these natural the disasters that have happened, like Chernobyl, all these have happened, ExxonMobil, all these have happened during the wee hours where a person needs to be in deep sleep, 2, 3 in the morning. So decision making skills are poor. So you need to get enough sleep for your mental well-being. It's even studies have even shown that the lesser you sleep, the more prone you are to anxiety disorders, to depression, for that matter, even obesity, which affects everything. And it's like a vicious cycle. You get more and more depression or anxious feelings, you sleep less and less. So there has to be a control. So where can you break the cycle? It's your feelings, it's your mind that you need to learn to control. Sleep automatically gets better. And we do give medications for at least a short period of time while you're working on training yourself, your lifestyle changes, training your mind. We do give certain medications which help with that, which make the process faster. But eventually, you need to rely on your mind and lifestyle modifications for you to sleep better and not fall into these mental illnesses. But sleep is definitely essential for mental well being. And when you sleep, it's said that it cleans up the emotional buildup, it restores balance, it strengthens your decision making skills. So, all these are needed for your mental well beings, your stress management. So, it is definitely important, and the amount of sleep, the quality of sleep, and quantity of sleep both are equally important.
Excellent. No. Wonderful. I'm glad. That's why it is a non negotiable lifestyle luxury we have to
Exactly.
experience.
Absolutely.
There's
There
no
is
two
no,
ways.
yes,
How a person visits a
what
gym.
you're doing, how rich you are, what profession you're in does not matter.
Correct.
You need your sleep.
Sleep. And in fact, that's the new age wealth, I guess.
Yes,
A person who can work very productive, earns a lot of money, and sleeps like a baby. What
yes,
a combination.
absolutely.
What a combination. We don't
That's the
want,
definition of luxury.
like, correct. That's a definition of new age rich wealth.
Yes,
New age wealth is work, money, and sleep, along with relationships. We're
yes,
saying, if that's the idea of the mind and intellect in our institution is we want each one to enjoy their work. We want them to make good money. When it's a good money, what they deserve for their hard work, and then sleep.
yes,
It is all three should be there. In fact, one without the other two also doesn't work.
yeah,
You
absolutely.
can sleep well, but no productivity at all.
Yeah,
Or you can't generate any wealth. You have to generate wealth. You got to be productive. You need to have proper
everything.
relationships plus right sleep, right
Yes,
quality, quantity, and quality of sleep. See why we are saying it's not that it's possible.
it
It's
is possible.
difficult. It may be anything. There's no pain, no gain.
Yes,
If you do it, then you are a great example. You are a great inspiration, or you become a terrible warning.
yes,
No, you made all the money, but never did anything else. In the sense, couldn't sleep.
yeah,
So that's our gen- genuine wish and for all people and trying to help. I'm glad you're doing it from your medical standpoint, which is wonderful. And we are trying to do it from the spiritual standpoint. And
That's great to know that sleep is being essential part of your
yes,
talks and lectures, and I really appreciate it because from 10 years to now, the awareness on sleep has
yes,
increased.
yes,
The problem also has increased, but awareness has increased, and I am glad that people are working on it. People are working towards
yes.
betterment of sleep, and people are working on themselves to sleep better. I'm glad to know that.
In fact, before in a small aspect on snoring,
Yes,
they used to laugh about it previously, but now they've taken note of it,
yeah.
and then a lot of study is being done, and it is a health hazard almost.
Yes.
It is a
So what I mentioned, sleep apnea is an independent risk factor for a lot of major health issues like heart attacks, strokes, anxiety, depression, obesity, heart failures, kidney problems, lot of other any. See, it's the basic thing. Sleep apnea. What it means is your body is it's a breathing disorder during sleep, and your body is being deprived of oxygen while you're sleeping and trying to repair and restore your body. And oxygen is a necessity
it's not a
wherever you
luxury.
are, whether you're on the moon or in the state of coma, your oxygen has to be there, it has to be supplied. So body is being deprived of oxygen in this condition called sleep apnea. Snoring is one of the symptoms of sleep apnea, and it has to be taken seriously. It is a simple treatment. You just need to go through a sleep study, and whatever comes up on the sleep study, the treatment options will be discussed with you. And it's a simple thing that can be corrected. Your sleep quality becomes better. Your health becomes better. You feel good
The
after.
oxygen intake or the utilization is right then.
Yes,
That's
yes.
the
Oxygen
major aspect.
reaches
Reaches.
your body. There is oxygen. There is oxygen in the room that you're sleeping. It's just that it's not reaching your lungs in this condition called sleep apnea. So, with treatment, it reaches fine, and you sleep better.
And then you wake up better. That's
You
what I'm
wake
told.
up better.
You wake up with this kind of a sleep apnea, you feel drowsy when you wake up, or we
Yes,
feel a bit tired.
yes.
Or
You don't feel like you have rested enough, even though you're waking up after 8 hours or 9 hours or 10 hours of sleep. You will feel like you're waking up having not slept at all,
right,
or a chain of dreams, a train of thoughts throughout the night. You're sleeping, but it feels like the brain is continuously active. That's because of the lack of oxygen in your brain and your body. The brain keeps waking up, and I have seen patients who wake up 60 times an hour, which is like they're waking up every minute.
60
It's
times an
it's
hour.
worse than not sleeping at all. If you're waking up 60 times an hour, that
There's
means
something drastically wrong.
exactly. So imagine that person after treatment sleeps through the night, wakes up rested. It's a simple thing, and is avoiding all these major health issues like diabetes, high blood pressure. So
And
it's
I think this a lot of people are going through this one.
sleep apnea. It is the second most common disorder that we see. Insomnia being the first common. As I said, there's lots of types of insomnia: sleep initiation, sleep maintenance, psychophysiological. There's lots of other types, primary, secondary. Sleep apnea is the second most common disorder that we
And
see.
it is going unnoticed for many people.
Um, it's getting better.
Better. I mean, at least their awareness is coming up now.
Yes, it is getting
Previously,
better.
I've known, he roars like a lion in
Yes,
sleep.
yes,
It's like a joke it was, but now, man, this is not right. You
yeah.
can't joke about it. You got to become serious.
It used to be the people used to think snoring is a sign of good sleep, deep sleep,
Ah,
which was a
correct.
misconception.
Sound sleep.
In fact the person is not sleeping at
Correct.
all. So that's a misconception, and they need to be tested and taken care of.
All these things is lifestyle changes. If it can be
This
done
lifestyle,
properly,
yes,
it can be sorted out.
yes,
And we want to conclude that you can sleep in 10 seconds.
Yes.
It is like a baby. When I say 10
Yes.
seconds, maybe 10 minutes maximum. But sleeping like a baby, falling asleep in 10 seconds is something you have
Is
in mind.
possible. That's how we are made. That's how
Correct.
our bodies are made.
Correct.
If we are not sleeping, that means we are doing that to ourselves.
Correct. So thank you, Lavanya Garu. So kind of you to spend this much time, and look forward to many other sessions in this regard when we take it further. Thank you.
Thank you, Sreedharan Garu.
Thank you.
I'm glad we were able to do this. Thank you so much.